So this is where we are going into something really interesting. We wanted to also provide all of you with one supplement that can help your patients to reduce the risk, right? So something very practical you can take with you and start recommending patients when appropriate. And I love those recommendations because they're simple. They don't require too much effort out of patients. So even the patients that in their level of readiness, they might not be ready for doing a full dietary transformational, maybe they love their meat and potatoes and they're not ready to give that up. We still have very useful recommendations for them. So the first one, Curiolus versicolor. You might have heard about this as turkey tail mushroom. This is the more common and well-known name for it, and it's really gained attention gaining more attention now in the integrative oncology or functional oncology world, because it has potential to enhance parts of our immune system and has anti-cancer effects. This was a study that was showing, it's like a phase 1 clinical trial, investigated the safety and immunological impact of turkey tail. And the study found that a daily dosage of up to 9 grams was well tolerated and associated with increased lymphocyte counts and increase in natural killer cell activity, which could be very beneficial, obviously, for patients that they can reduce the risk, and also patients that already were identified or diagnosed with breast cancer. So let's take a look at this picture. So this is really interesting. So there's several mechanisms here, but essentially with turkey tail in the center, we look at several physiological impacts. So one, it triggers immune cell mediated cytotoxicity, right? There's also reported to include something that's called polysaccharide K and polysaccharide peptide, which are, I would say, probably the two most studied bioactive compounds in turkey tail. And those are known for stimulating natural killer cells, which are designed to, destroy, designate and attack or target cancer cells. Also, they can stimulate T cells and macrophages. And now, interestingly, they also have immunomodulating impact. So we don't go into that. We're not going to get into this today, but we talked a little bit about inflammation. And there are certain inflammatory pathways and some studies that are showing a strong association between systemic inflammation, chronic systemic inflammation, and risk of developing cancer, right? And it's important to know, because if our patients struggle with systemic chronic inflammation or autoimmune condition, it could possibly, and it is association, right? So it's not a causation, but association, but could possibly increase the risk of cancer. So turkey tail was also reported to essentially help our body to modulate some of those inflammatory pathways. And then it has anti-proliferative action, which means that it helps to support the inhibition of tumor cell growth, right? And also induce apoptosis in certain cancer cell lines. So lots of really great studies when we talk about this particular turkey tail. One study that I mentioned, they use 9 grams. The typical dosage that most studies are recommending to go with to avoid GI side effects is typically 3 to 6 grams per day of a standardized extract, or 1 to 3 grams a day of those concentrated polysaccharide K or polysaccharide peptide. But we like to use the full spectrum. I typically like to recommend the full spectrum. So 3 to 6 grams of the standardized extract is what most studies would recommend. Potential side effects are GI symptoms like nausea or bloating. It might be contradicted in some patients with an autoimmune diseases unless you supervise them, right? To make sure that it doesn't interfere with other medication or anything like that. So let's take a look at a picture from a supplement. This is a supplement that, this is a hot water extract. And you can see that essentially in one capsule, it contains 500 milligrams of this compound. And we like to use professional grade. We like to recommend professional grade because you can also see here the amount of polysaccharides that you are getting, right? So you're getting, they already tested it, and you can see that you're getting 55% polysaccharides, which is those are the active compounds that we talked about. We mentioned the polysaccharide K and polysaccharide peptide. So this is an example of a professional grade supplement. So essentially, to get to that dosage that I was talking about, the 3 to 6 gram, and if your patient takes, let's say, 3 grams, starts at 3 gram, they'll probably divide the dosage. So probably, let's say, 3 capsules in the morning, 3 capsules at nighttime will give you 3 grams per day of the standard extract. This extract has a relatively higher concentration, 55% polysaccharides and 50% beta-glucans. So that's a really good dosage. 3 grams is a really good dose. And if your patient reports they have some digestive upset, then taking it with food or a meal is sometimes very helpful. By the way, if you're interested in learning more about those clinical strategies, the integrative strategies, and expanding your clinical toolkit and learning really how to better support your patients using the herbal, nutritional, lifestyle medicine and targeted supplements that are simple and affordable that they can use right away to improve their health, feel better, and for whatever chronic condition that is, then I want to invite you to explore the Integrative Health Practitioner program led by Dr. Esha. And there's also specialty classes by other experts in integrative medicine. And this is a 10-week certification program that has a live class on Monday evening, and then everything is recorded, and there's some additional on-demand class. What I really like about this program and the feedback that we got from healthcare practitioners, nurse practitioners, physicians, nurses, pharmacists, is that this is a very, very practical program. So every week you go into like cardiovascular, 1 week autoimmune conditions, another week you go into women's health conditions, chronic pain, mood disorders, neurological conditions, or geriatric. So if you're seeing those conditions in your practice and you're asking yourself, well, or your patients are asking, what else can I do to feel better when I struggle with these conditions, then you're going to learn and be able to apply it right away. And this program, by the way, also includes the Integrative Nutritional and Herbal Medicine Clinical Guide, which has tons of strategies. It's really, really beneficial for all healthcare practitioners. So if you're seeing chronic patients, you want to offer more comprehensive care, help them to improve their health and wellness, and better manage those chronic conditions, then this is the program that can help you do that. And you get certified within 10 weeks. So I just wanted to mention that we currently have a special scholarship of $2,100 until the end of the month. And you also get 3 years access to the phone app with all the treatment protocols for hundreds of adults and pediatric chronic conditions. So check it out. If you're interested, you can get more information with our team at the American Academy of Functional Health.